This rhyme is a puzzle, as you will see. This rhyme tells you what a good leader should be. A good leader respects the young and the old. A good leader observes and is prepared to be bold. A good leader is brave and will try something new. A good leader works hard and gives praise where it's due. A good leader expects the best from all staff. A good leader brings happiness and shares in a laugh. A good leader supports patients and gives them the best. A good leader teaches staff to be ahead of the rest. And a good leader explains if something goes amiss. A good leader rejoices in times of great bliss. And if you study this rhyme and look very close, you'll discover the leader I admire the most.
What we do matters. It makes a difference. And as the NHS Constitution reminds us, we touch people's lives. When they're at their most vulnerable, we create memorable moments. Memories that are never forgotten.
I just want you to jot down in each of the boxes one thing that makes a difference, or one thing that's the most important thing to you in your life in each box. I hope there's no dodgy ones. I may ask about them later. I want you to cross off 3 things out of your list that are the least important out of them 6. Okay, what I want you to do now is to cross off another one. I know it's getting harder, isn't it, because you're choosing between family and friends and money. Does anybody want to share with me what 2 you've got left? Somebody be kind to me and share with me. What have you got on yours? Family and friends. Okay, I want you to cross one more off. I know, very cruel, very mean. Okay, you should have one thing left. Can I have a show of hands as to how many people had family? I think that's pretty much overwhelming majority would have family as their main thing. So one of the things that we decided to do a number of years ago was to look at developing a model for patient and family-centred care, which is different to person-centred care, because this is about including the family as much as we can in the care in which we deliver.
But we had to have some improvements and changes made to it to make it fit for purpose for patients.
Our HR team have been fab and completely taken this on and used it to develop a framework for recruiting staff based on values as well as skills.
And each small group of students has the opportunity to listen to a carer simply talk about their role in supporting the patient.
Why were people saying that about their service? And that's the first time that GPs had that real feedback from people with learning disabilities.
But like you all have, we've got some big hurdles still to cover. But thank you very much for listening.
What can I say? Thank you very much.
Thank you.
As you can see, we now know from the clinical trial that we've improved patient outcomes. 82% of all of our patients are offered our cardiac rehabilitation service. This is almost double that of the national average.
And when we ask young people, how can we do this safely? How can we deliver this in a safe way? They said, well, why don't you just invent a computer system that will manage all the risk? You know, kids don't see limitations or margins, do they? So
the process of supporting someone else and acting with compassion, it triggers a response in our brains that is usually triggered when we experience pleasure or reward. So we're hardwired naturally to reach out for the others, and that in itself can be self-perpetuating, because the very process of reaching out is something that in itself makes us feel good.
Okay, and the overall winner today is the Leicestershire Partnership NHS Trust. It's the Chat Health and School Health.
So a massive thank you to all of the partners and all of the people who've chosen to support us today and for your ongoing support. So thank you.